I am your host, Dr. Rahi Victory, a board-certified reproductive endocrinology and infertility specialist in both Canada and the US. And a huge shout out to all of you who allowed me a week off. And my good buddy Tarek from Ibrahim Strategies Group, who does all our things social media, who also put up with me taking a week off. I needed a break, and so I headed up north with family and had a fantastic time. I would like to publicly and personally thank my incredible kids who flew out from various parts of North America to come and join us. My nephew and his wife, who also flew out to be with us. My mom and dad, and my mom especially, who worked tirelessly to help us while we were there. And of course, the love of my life, Wendy, who worked her butt off there and afterwards to clean up and keep us fed and keep us on track. And she surfed without the rope for the first time. I didn't tell you that, but Wendy actually surfed without the rope for the first time, which was very cool because she hates the water. So that was really good. Lots of fun up there. So this week, there are some new studies out that I do want to share. But I'm just going to address one thing quickly, and then we're going to go straight to your questions, because last week what we did was just a video where we answered previous questions. It wasn't actually live. And this week, I figured I'd allow you guys to go back to asking your questions live. And then next week, we'll jump back into, doing a paper at the start of the show. So the one thing I keep getting asked about, because of that Instagram video I posted about the, I don't even know what kind of bird that was, that had the funny look when people do the ERA test. So I freely admit I pilfered that video from somebody else and repurposed it. But people keep saying, like, what, other doctors are still promoting the ERA test. So Tarek knows this is my favorite subject, and that's why I used that funny video, because it just fit perfectly. The ERA test is dead. There is absolutely incontrovertible, irrefutable evidence that it doesn't work. It can't even test what it says it can test. So Kevin Richter, Ichter, if you're looking for the author, reviewed a randomized controlled trial done by somebody named Doyle in the Journal of the American Medical Association, one of the biggest journals in the world, JAMA, and he reanalyzed the data they had. What they didn't realize was, even though they showed that there was no benefit to doing the ERA test, what they were actually able to show, which was huge, just enormous, is the ERA can't even differentiate between receptive and non-receptive. So in the group of people that were tested, but all had the same transfer time, which was 5 days of progesterone exposure, and then they went ahead and did a transfer, the ones that were deemed receptive and non-receptive had the exact same outcome, which means it actually doesn't work. The test doesn't even detect whether you're receptive or not receptive. Obviously, in those who were receptive at the 5-hour mark, they would have had a higher success rate than the ones that didn't. And there was no difference between those two groups. So they actually had one arm of the study where everybody was tested, but despite being tested, they went ahead and did the same transfer time for all of them. It's like probably the best study design ever. And what they showed was there was no difference between groups. So the ERA test is dead. Anyone promoting the ERA test literally is not reading and does not understand the science behind it. So the ERA test should not be done. If your fertility specialist or fertility center is still telling you to do the ERA, then ask them to look at that Richter study and explain on what basis they're claiming it works, because it can't even detect if you're pre-receptive, post-receptive, or receptive. It literally can't tell the difference between any of them. So it's a waste of time. It's a waste of money. I'm begging you, please stop doing the ERA test. I have no financial involvement with iGenomics. They're lovely people. I know some of them. I even considered hiring someone from iGenomics at one point. They're lovely people, but the test does not work. So it's not about the company. It's about the test. The test is useless. Don't do it. It's a waste of money. So hopefully that puts that to rest. If you need to see evidence of that, you can look it up in the Richter study. And if you want to look at our video on it, I don't know if you can put it up, or we'd have to go back in the YouTube videos and find it, but it's on our YouTube channel. It's probably about 2.5 months ago where we reviewed that study. and showed that it's of absolutely no value whatsoever to do an ERA. So hopefully that puts that to rest. And with that, we are going to start taking your questions live. And I will do my best not to lose my voice, although I think for the first time in my life, I am succumbing to some allergies. Not something I'm used to, but it is what it is.
It happens.
It happens. So what's going on?
Hello.
Is that from you or?
No, that's from me. I gave my pleasantries earlier.
All right. Okay.
Yeah. Hi, Dr. V.
Hello.
This is another comment. The first one was actually just hello.
Hello.
Exclamation. It's like, is this thing on kind of a thing. Hi, Dr. V. What are your thoughts on low-dose naltrexone?
Yeah, so there is some weak evidence that I've seen that shows that low-dose naltrexone may be beneficial, in particular in PCOS patients. I don't find it convincing enough for me to start doing it yet, and I kind of feel like we're getting to a point in the fertility world where we're just sort of throwing everything we can at people, and I don't know that that's beneficial. I think we're hitting a saturation point where there's sometimes too many things you can do. So, and maybe overdo it and do some damage or have a less than adequate or appropriate outcome. So we are not using low-dose naltrexone, but there is evidence out there that suggests that it may be beneficial in certain cases. PCOS is the big group that's being looked at. There is some evidence that it's helpful there. I just realized I stuck the tea mug right in front of the TikTok camera.
Yeah, just
it's like this giant tower in front of the TikTok. Sorry about that, TikTok.
Question from TikTok to make it up to that.
There you go.
Good evening.
Good evening.
Is cramping at 34 weeks pregnant normal? My first baby, and I'm worried.
Some cramping can be normal. I would always advise you go get checked out by your physician. As a general rule, if it's rhythmic, meaning there's a consistent pattern to it every 5 minutes, every 10 minutes, it's getting stronger, there's any bleeding, there's leaking, the frequency is getting closer together, so it went from every 15 to 10 to 5. The intensity is increasing, the cramping is getting longer, it went from 10 seconds to a minute, that kind of thing. Those are all concerning features for anyone, for warning signs that they are going into labor. So as a general rule, if you have any of those types of warning signs, you need to be evaluated by your physician or a hospital or an emergency unit or whatever access you have. In the absence of it being regular, aches and pains in pregnancy can be common. The keys are to make sure the baby is active, you're not bleeding, there's no fever, nothing abnormal is going on. Nevertheless, as a general rule, if you are concerned, you should always be evaluated, and that's just, very, very simple common sense. Make sure that you're checked out if you're worried about that. That's very, very, very critical and important.
How long after an egg retrieval is an FET performed? Is it 21 days after your next menstrual cycle?
Well, it varies from patient to patient, but it depends on what kind of frozen embryo transfer you're doing, what your history is. Do you have endometriosis? Did you have hyperstim? All of those things are really important. So we don't generally give people that kind of a timeline, and it's certainly not 21 days because it depends on how long it takes for your lining to mature. Some people are ready 11 or 12 days. Some people need 20 days to get their lining ready just before you start 5 days or 6 days of progesterone. So it varies from patient to patient. Typically speaking, we're starting patients the following month, so about 2 months from the time that they did their egg retrieval. As a general kind of overall umbrella approach to this. And in that circumstance, you're really looking at, on average, somewhere between about 17 to 25, 26 days for it to, basically be ready for you to have an embryo transfer.
Hello. Yeah. Is IUI worth trying if you have both endometrial hyperplasia and atypical polypoid adenomyoma?
Atypical polypoid adenomyoma?
Yeah, that is, to my best of my knowledge.
So I've never heard of anything described as an atypical polypoid adenomyoma, and you can't transfer if you have endometrial hyperplasia. You have to deal with your endometrial hyperplasia. And if you have atypical endometrial hyperplasia, there is an underlying cancer risk. So you need to see your gynecologist, because none of what you said fits with fertility. That all has to be dealt with first. So please make sure you are assessed by a gynecologist who has expertise in gynecology, or a reproductive endocrinologist that still knows what they're doing in the gynecologic realm. If you're with us, I would never let you go ahead in that scenario. You must be treated first. In fact, I saw one of my patients today who previously had a long period of atypical complex hyperplasia, and we had to treat it for quite some time before we finally got her stabilized enough to do her embryo transfer, and now she's close to being due. So it took years to get that organized. It's not a quick fix sometimes, and you need careful attention, or else you can end up very sick from that and potentially in harm's way with cancer developing. So please make sure you are properly assessed.
Welcome back, Dr. V&T. Have you come across any studies saying maca roots helps with fertility? It's been all over TikTok lately.
Yeah, so we just made a couple of videos on the benefits of maca for sexual function in men and women. There is evidence that maca is helpful for fertility, yep. So there are studies on egg quality, there are studies on outcomes. It does seem to be helpful. It's just another antioxidant in all the, panoply of antioxidants that are available. So I don't prescribe it or offer it to people for their fertility care, but it's certainly reasonable to consider using. There is pretty decent evidence for it. Keep in mind, I've made fun of people on Instagram before for saying if you rub this oil on you, it's going to treat your fibroids. And if you take, people still believe that vitamin C will shrink fibroids, and, getting castor oil packs will modify things. Like, that stuff does not work in terms of major alterations in your fertility. And in some instances, it won't work at all. So you need to be cautious when interpreting stuff like that. Is maca root going to change you from being infertile to fertile? Probably not. Is it going to help you on your fertility journey? It might, under certain circumstances in certain patients. But, is it going to supplant IUI, IVF, surgery, treatment of endometriosis, seeing a reproductive endocrinologist? Of course not. So be realistic about what your expectations are when you're using those supplements.
Here's a comment I can relate to.
Okay.
Hi, Dr. V. How crucial is exercise? For me, that's where that question stays.
Yeah.
Right? But she obviously has a different aspiration for it. So how crucial is exercise while pregnant? I work 40 hours a week and I am drained after work.
Well, first of all, I apologize for a horrible society which doesn't value pregnant women enough to understand that they shouldn't have to work as hard as everybody else does. So I'm sorry about that. I wish I could change it, but that's not going to happen. How important is exercise? We actually have a really wildly popular video on Instagram and TikTok, I think.
Especially on TikTok.
Especially on TikTok about exercise and pregnancy. So, light exercise like walking is actually not particularly useful, and it doesn't do a whole lot. More moderate exercise is actually very beneficial. Heavy exercise like weightlifting, that kind of thing, should only be done if you're accustomed to doing it. Otherwise, it can cause an increase in complications. So moderate exercise is best. Swimming is wonderful. If you can afford even 20 minutes of moderate exercise, that's actually not an unreasonable thing to do. I realize the exhaustion sets in. So again, talk to your doctor as always. Do what you can. But the studies, which is what we always reference, support that moderate exercise is best. Watch that TikTok video. And you'll see it. I don't know where it is on the...
It's pinned.
It's pinned?
I think it's pinned.
It's pinned. There you go. I think we had about 50 or 60,000 views of that one, right?
That's a good one.
Yeah. Or was that the one that was at 100? No, that one's at like over 100,000.
That's over 100.
Yeah, 130,000. Yeah. Yeah.
How many IUIs would you say to stop after unsuccessful?
No, we have a YouTube video on that. If you're less than 38, 6. If you're over 38, 3. There's a big Chinese study that they analyzed the data from, and that's what they showed. So that's what we stick to. Less than 38, we'll do up to 6, and then over 38, we only recommend 3. I have had patients that, made exceptions and wanted to continue, and in rare circumstances were successful. But the study shows a 0% success after 6 if you are under 38, and a 0% success rate over 38 after you've done more than 3. So we keep it in that range.
Hey, Dr. V, do you ever end up with more eggs at a retrieval than follicles seen on a baseline scan?
Oh God, all the time. Keep in mind, you're at the mercy of your ultrasonographer. So if they didn't count every single follicle, or the ovary wasn't rotated the right way and they couldn't see every single follicle, you'll miss some. But then as you start draining them, the ovary will move and rotate, and follicles that were out of view are now in view, and you can drain them. So we've had some where we expected to get 25 and we ended up with double that number. It happens all the time.
After changing diet for the man and woman, how long will it take for egg and sperm quality to get better, generally?
3 months for a man, because it takes us about 3 months to make new sperm. And for a woman, there's no way to measure that. But you're probably looking somewhere in the vicinity of about, most likely somewhere in the vicinity of about about 2 months, 3 months as well. It's hard to know because we don't really know how much of an impact things have on egg quality, because it's a very difficult thing to measure. And you can't compare eggs before and after because you only have a limited number, and it's not like we're doing IVF just to see how women's eggs respond to stuff. So it depends on what's happening.
Dr. V&T,
That's us.
what are your thoughts
Yep.
on Violet Report?
On who?
Violet Report.
Never even heard of it before. Violet Report? Mm-hmm. Like violet the color? Mm-hmm. Report. Mm-hmm. No clue. You want to look it up? Never even heard of it before.
Violet and predicting egg quality with Violet AI-based reports.
Oh. So listen, there's a reasonably well-known fertility specialist from Canada who's developing an AI-based egg quality reporting system. To date, there are no AI systems that have successfully, consistently reproduced any kind of finding that is of value. None, literally zero. None of the systems, when put through rigorous testing, have demonstrated a benefit. That's not to say they won't be helpful, but at the moment, there's nothing that works that shows any positive outcome. We actually, literally about an hour ago, made a video about how ChatGPT lied to me about sex. So that'll be out shortly. But I use ChatGPT because I keep seeing it pop up on my Instagram. Put yourself on this and then put yourself on that and tell it to do this. And I was like, okay, let me try it. So I looked up.
I was trying to replace me.
Yeah, I was trying to replace Derek, he says. So I looked up, or I asked ChatGPT to to look up some references for me for a relationship between the duration of a sexual episode, coitus, and satisfaction. And it actually made up a study. So AI is not necessarily all it's cracked up to be. And then it apologized for making up a study. And then I literally said, did you just lie to me? And it said, well, sometimes I make mistakes. So, AI is made by humans. So as such, it's still going to be fallible and subject to making mistakes, as we all are. And so be careful with AI. It's not what everybody thinks it is. It is not the solution to all our problems by any means at all. The earliest example of AI in fertility is the software used to analyze the development of embryos microscopically in time-lapse incubators. I now own 2 of those time-lapse incubators. They're psychotically expensive, very fancy and sophisticated. And when you look at the data from that stuff, and you look at the randomized controlled trial that they did comparing a conventional incubator to these time-lapse incubators that chose the best embryo for you, there was no difference in the outcome. So we don't use that. We just use our time-lapse incubators because they're convenient. But the technology, the AI, it's not there yet, guys. So don't rely on AI to be your savior in the fertility realm. Maybe someday it will be, but for now I still have a job. And so do you.
This is a great day.
Yeah, and so do you. Yeah.
How often would you have to do intralipids for FET?
Well, our general protocol, based on a bunch of reports when intralipids was first coming out, was to use it 5 to 10 days before your embryo transfer. On the day of the embryo transfer, at the 2-week mark when you get a positive test result, and then every 6 weeks. Some people stop after the 12-week mark. Other people want to continue. Most of our patients want to continue because they're too afraid to stop. Somebody on TikTok asked the weirdest question ever.
I looked it up what it means.
I don't know what that is.
It's basically chugging it from a funnel.
Where do people come up with this stuff from? That's hilarious. And thank you to all those of you that do watch our TikTok channel. If you're watching on TikTok, over on this camera, amazing numbers and support on TikTok. So we appreciate that greatly. Many of our videos have gone viral on TikTok. And it's so funny watching the interplay because the same video we put up on TikTok, which got 540,000 views, 570,000 views as of today, got like 900 on YouTube or something like that, right? It makes no sense. And like 3,000 on Instagram. So I don't understand how these things work at all, but our TikTok fans are quite wonderful. So thank you if you're watching that.
Hey, Dr. VNT, 2-part question. Ready?
Ready.
Thank you both for the amazing info and for the laughs. Tuesday is my favorite day for sure.
Oh, that's awesome.
For the Lupron that you use at day 21, is it a single shot or daily? And what is the dose? Also, I did 3 months of Lupron and LETR, but ended up canceling my FET because of my infection came back. I'm waiting for my period. What do you think about day 21 Lupron shot before my period comes in?
Okay, so it's 3.75 milligrams one-time Lupron depot dose on cycle day 21. You don't have to do daily shots. And then if you already took one shot and you're about to take another one, then you're ending up probably going into full suppression. So you likely wouldn't respond to any meds. You'd have to then take estrogen. That's fine. But an estrogen-based protocol has the lowest chance of success. So I don't do that, but it's certainly doable if you wanted to do it. The boofing guy followed up
with a follow-up?
saying that that's in your behind.
In your behind. That's what's boofing.
I don't have any. I don't drink.
Unfortunately,
so, Rob, I can't help you, buddy. I don't know where you even came up with that crap from, but I've never had a drop of alcohol. Alcohol is basically poisonous, so I avoid it like the plague.
Yeah, he's boofing.
And Tarek is the same. He doesn't drink either, which is part of why he's a good buddy. So.
There you go.
Yeah.
Do you work with patients? Yeah. Do you work with patients? Oh, hold on. There's a little bit going on here.
That's because of the boofing.
The boofing took precedent. The boofing took precedent. Do you work with patients with testicular microlithasis? My partner and I have been trying for a year.
Yeah, sure. Yeah. All the time. We have lots of patients with various male factors. We actually had a great interview with Dr. Ramasamy a couple of weeks back when we were in our Sarnia office. And that video is up on our YouTube channel as well. He's fabulous, very knowledgeable guy. So yeah, we do lots of male factor things, and we would be happy to discuss that with you. Not a problem at all.
Do you work with patients? Oh yeah, we did that. Yeah, okay, so that's taken up to We'll go to IG for a bit.
You're caught up to boofing.
Yeah, I'm caught up to boofing. Boofing in the follow-up explanation. Why does Canada require patients to sign a waiver if you want to use human growth hormone for egg retrieval and the US doesn't?
Because it's off-label, so they just don't want to get in trouble. That's all.
There you go. Thoughts on Omnitrope?
Good for egg quality. No increase in live birth. More mature follicles, probably more follicles. Higher rate of good quality blastocysts. Higher rate of fertilization of your eggs. So there's a number of benefits, but they've never translated into higher live birth rates. Probably lack of data because all of the other things are supported, but we don't know. So I do use it fairly liberally, which is funny because years ago, like a long time ago, 10 years ago, 12 years ago, I started using it and I didn't think it worked, so I stopped. And then I started it up again when more data came out, and I do actually think it makes a little bit of a difference now.
Interesting comment to the follow-up of the patients with the micro.
Yeah.
Yeah. She then follows up and says, "Thanks for answering my question. I'm being referred to a fertility specialist in Windsor next month."
That would likely be me. So we'll see you soon. Yeah.
She probably doesn't know. That's great. She just found out you're her doctor. Yeah. That's cool. Hello to both.
Hello.
Thoughts on metformin when starting an FET?
So metformin would be great if you have PCOS or you're struggling with your insulin levels. Otherwise, I'm not aware of any data that suggests that blindly using metformin for everybody is beneficial, so I wouldn't recommend that. It is also wretchedly upsetting to your stomach, so it's not something you want to start when starting an FET process. You got to be on that for months to get your system basically into what we call homeostasis, which is physiological balance. Taking metformin right before you start a cycle, you will not be a happy camper at all.
Do you recommend your patients and their partners go on antibiotics before transfer? I'm resistant to Z-Pak. What are other recommendations?
We do use it, although the more I learn about the vaginal and uterine microbiome, the less useful I think blind antibiotics are. So if you're worried about the microbiome, then do the testing to figure out what you have and then target the treatment. If you're not worried about the microbiome, then I would definitely say your best bet is probably to start with a Z-Pak. If you're allergic or sensitive to that, doxycycline would probably be your other best bet, and we use that quite liberally.
Hello, my favorite doc. How do you add letrozole in a modified natural cycle with trigger plus 7 days?
Okay, so I don't do that, but the way you would, because you're asking that, is you take letrozole from day 3 to 7. You'd wait till you've got an 18 millimeter follicle. You would trigger, and then you would do your plus 7 days. We actually don't trigger, and we just start progesterone once the lining's thick enough. There's no benefit to triggering. It's just an added expense and an extra unnecessary shot. Keep in mind, in a natural phenomenon, your body isn't taking 10,000 units of HCG in order to make you release an egg. So that's a very non-physiological event, so we don't do that. And there's no data supporting that it's beneficial or detrimental. It's neutral. But why take something if you don't need it? And it's certainly not physiological, so we don't do it.
Good evening.
Good evening.
What is the quality of frozen embryos before to be transferred? Is there?
I love the trail off. That was amazing.
Because I'm reading and thinking I must have missed something.
Yeah.
I didn't.
What is it?
Let me try again. Sorry.
Okay. Yeah.
Good evening. What is the quality of frozen embryo before to be transferred? Is there any stage of quality from bad, good to very good? Yeah. How we know what quality of embryo will be transferred? Thank you.
So embryos are scored morphologically, so they have a number, and well, it depends on which scoring system, but traditionally there's a number which is the degree of expansion of the embryo within its shell, or starting to come out of its shell, and then a score for the trophectoderm, which is the part that's becoming the placenta, and a score for the inner cell mass, which is the part that's becoming the baby. So the best embryos for transfer are 4AA, 5AA, and 6AA. So that's what you're looking for, and then from there it goes down in terms of the numbers. So 3-2-1 would be less amazing, but still good. AB is not as good as AA. BB is not as good as AB. Anything in the C grades, and you're really going to see a decrease in success. There's some interesting
wild
comments on TikTok, eh?
Yeah.
Yeah. What are my thoughts on Clomid for testosterone replacement for men? I can answer that one.
There you go. That's a good one.
And it's got nothing to do with boofing.
That's right.
Yeah. So Clomid is really good for men. In that interview with Dr. Ramasamy, he mentioned it too. And he actually uses it every other day because Clomid's got a long half-life, which I had never heard of before. So that's kind of neat because it saves guys a lot of money. So it is very good at improving your testosterone levels naturally. It can be used in conjunction with HCG, and sometimes you'll need that. But Clomid's a very reasonable product to try.
When do you know that you need to do a laparoscopy?
Oh, wow. That's a great question. So I don't think you can ever know unless you can clearly see something on ultrasound. You've got some kind of abscess present. You've got a clear endometrioma. You've got a fibroid that needs to be removed, and they can do it laparoscopically. You've got, a dermoid cyst, anything like that. Sure, I get it. Then you're sort of bound to doing it. But unless you can see something on ultrasound, the only other times is suspicion of endometriosis. So that brings up the 3Ds. Deep pelvic pain, dyspareunia, which is painful intercourse, and dysmenorrhea, which is painful periods. There can be other symptoms as well, but those are the three big ones. Certainly repetitive failed embryo transfers or IVF cycles, or even IUI. All of those would be reasonable indications to explore, what's going on laparoscopically. Because if you do have endo, that needs to be treated because it will improve your success rates.
I have a good question here for you.
I like the one about how I get rid of my AIDS.
If you want to take a stab at that.
I don't know if I told you this. I actually have a patient who had HIV positive status, and it's gone. He's cured of his HIV. It's gone. Like, there is not zero viral load. He's antibody negative. Like, it's gone. Completely done. Yeah, apparently, and I didn't know this because it's not a lit that I follow that closely, you can actually cure yourself of it completely sometimes. I think they said about 10%.
Wow.
It's gone.
Ain't that something?
I didn't know.
I didn't know.
Yeah, it's pretty cool.
I'm always learning something new.
Black History Month or Halloween? Tark just threw his hands in the air. Listen, I am a avid Halloween guy because I love carving pumpkins. I do those crazy fancy pumpkins, but I would never exchange the value of Black History Month for something as trivial as Halloween. My very, very, very dear friend and one of my best friends is black. So I think the value of Black history is imminently more important than something as commercialized and silly as Halloween. I do love Halloween, but not as much as I think the world should be more equitable to all people of all races.
There you go.
There you go.
Can you explain embryo glue for FET and what is a good level of estrogen to be at? I don't know if those are the same questions, but they're the same person back to back.
Embryo glue is basically hyaluronic acid. I don't think we exactly know how it works or why it works, but it does work. So there's no question that the studies support that embryo glue increases your chances of success. And so we've integrated it into our protocols for all of our patients. As far as a good estrogen level, most of us don't actually pay too much attention to the estrogen levels. As long as you're not overshooting, you don't want it too high, you don't want it too low. There was one study that showed that it should be over 100 picomoles, but that was the only study I've seen. And we reviewed that, probably 18 months ago, looking at estrogen levels. So that was the last time we checked that out.
Chances of conception in late 40s or in 40s. Oh, in late 40s.
Even with advanced therapy, probably less than 5% to have a live birth. If you're in your late 40s, it's going to be really minimal. So you're probably looking at 1 or 2%, 3%. It's still possible, but it's very difficult because the number of eggs that you have that are genetically normal is drastically reduced. So your miscarriage risk is probably somewhere around 80 to 90%, because even if you do conceive successfully, God willing it happens for you, your chance that the embryo is abnormal is sky high. So it's very difficult to be successful. I love the guy that asked Black History Month or Halloween. We have some really wild Instagram, TikTok followers.
It's nothing but wildness.
Yeah, I love the comments from the video, the one about pregnancy symptoms. They were just crazy.
Oh, yeah. Everybody was pregnant.
The best one was the guy who said he had all of those symptoms. We should have pinned that comment. It would have been hilarious. Yeah.
Any issues with swimming in a lake prior to an FET, as long as it's hours after suppositories?
No, as long as you don't pick up schistosomiasis, you're fine. There is a bacteria amoeba thing that you can pick up in a lake, so you got to be careful. But I spent the last 10 days in the lake. Not that I'm about to have an FET. I'm doing them all the time. I did 4 today. But there's no risk as long as you don't pick up a bug.
How does the funded IVF in Ontario work? If someone pays upfront for the treatment, will they get a refund from the government?
No. So funded IVF is not a refund system. It's an assignment or allocation of funds to a patient who is an Ontario resident and who is under the age of 43. Those are the only 2 criteria. And it is specific to the cycle you do once you've been allocated the funds. So in other words, we accept you as a patient, we work you up. Yes, you need IVF. Okay, great. There's funding available. Terrific. Here's your funding. Go do your cycle. If you came in and said, I don't want to wait 6 months or whatever, 3 months or whatever the timeline is to get your funding, I'll pay for it now. And when my turn comes up, I want to be refunded. It doesn't work that way because they're not paying you. They're actually paying us in order to perform a cycle, and we don't even get paid until we've actually done your egg retrieval. So an egg retrieval has to occur for us to get the funding from the government, and that egg retrieval has to occur after they've approved you within the program. So it's not a retroactive. You can't get refunded. Same thing for frozen embryo transfer. There's 2 parts to the funding. There's the IVF part, plus minus a fresh transfer, and then there's the frozen embryo transfer part, which they also fund. Woefully poorly, but they do fund it.
Can you do both NIPT testing and a NT ultrasound in Ontario, or is it one or the other?
Well, the NT ultrasound in combination with several blood markers, which is called early first trimester screening, EFTS, is free for all Ontarians. So everybody can get that. If you meet certain criteria, twins, previous trisomy baby, age over 40, that kind of thing, then you qualify for NIPT. So it depends on who you are and what's going on with your pregnancy. You can pay for NIPT if you don't qualify and get that done. We use Invitae in the US for that, but there are different companies that do it. There are some in Canada. They're just more expensive. And you can do that and still do your EFTS, although I would question why you would do both. I mean, it's a waste of a jab in the arm, but some people like seeing their baby on ultrasound. That's the only reason to do both. The NIPT is a yes-no answer. EFTS is a screening test used to score your risk. So EFTS will come back saying your chance of the baby having Downs, for example, is 1 in 500. NIPT will say you have it or you don't have it, and they are 99.9999% sure because it has a 1 in 10,000 error rate.
You ready?
Probably not, because when you ask me if I'm ready, it's always some weird question. Fire away. Oh, that's a problem. Sorry, TikTok. We're going to just pause for a second. Oh, that's Aaron. I don't even know how to do that. Aaron's going to have to go away.
could
I don't even know how to cancel them because it's saying join.
No join.
No join.
Hi, Dr. V.
Yeah.
Oh, sorry. 41, 2 failed IVFs. My RE said, there you go.
Yeah.
And you're back.
And I'm back.
My RE said,
41.
let's review, shall we?
Okay.
41,
Yeah.
2 failed IVFs.
Yeah.
My RE said that IVF is the same percentage success as IUI, less than 15%. High BMI for me, hypothyroid, good sperm for partner, yoga and walk daily. Should I do an IUI HSG okay?
IUI and IVF do not have the same success rate, but that is very dependent on your lab. So, I mean, in our lab, our IUI over 40 and our IVF over 40 are wildly different. So I definitely can't say that those two are the same thing. So I wouldn't tell you in our lab to do that, but it depends on the success rates with your lab. As you get older, your success rate with IUI and IVF kind of start to get closer and closer because they're both really low. You're talking single-digit success rates. The high BMI is a problem. Depends on how high your BMI is. Hypothyroidism is easy to manage. If your BMI is high, walking and yoga will not be sufficient to make you lose weight. You need to do weight lifting in order to lose weight.
Progesterone level is 50 milligrams 2 days before transfer.
Say that again. I'm reading the TikTok. Some of this stuff is wild.
Yeah.
Go ahead. What was that?
We'll get to that one. Progesterone level is 50 milligrams 2 days before transfer. 50 mgs before transfer.
That's not a level. So 50 milligrams is your dose of taking progesterone. Your level would be something in nanomoles per liter or nanograms per mil. So I'm not sure which one you have. Maybe you were 50 nanograms per mil, which would be very high. If you were 50 nanomoles per liter, that'd be on the lower side of the normal range.
The question continues.
Oh, okay.
Up from 0.5 lm to 1 ml. Milliliters. It's got to be milliliters. Upped it from 0.5.
So they went from half a mil
to 1 mil
to a full mil.
Yeah. Do you think it could get up to 150 by Thursday with that increase?
Oh, so she must be doing nanomoles per liter. Yeah, it could. It definitely could get up to that level. Yeah, for sure.
Progesterone level was 50. Same question. Same continuation, rather. Was 50. 2 days before transfer, upped it to 0.51. Do you think we're... by Thursday?
It's certainly possible.
I have endo. That was the final part of it.
Yeah. So you want that high proj level. It's certainly possible. If you were at 50 and you doubled it, that's probably reasonable. I would talk to your doctor. I mean, I might go to 1.25, but it's certainly reasonable. TikTok? Oh, yeah, you could go up to 1.25. I think that's reasonable. But even 1 mil might be enough for you. So you probably don't need to double it. Yeah.
Hello. Thank you for this amazing opportunity with Dr. Victory live chat. High fives or prayers. I'm not really sure which one they are at this point. Everyone says they're high fives. I've always thought they were praying. I don't know. Is it allowed to use the pool and hot tub before the embryo transfer?
No, definitely no. Loads of bacteria. It's like bacteria soup in there, even when it's really clean, and it's overheating your body and drawing blood away from your uterus. So don't do that. That's a bad idea.
Big fan of the term bacteria soup. I like that.
Are you going to answer that question?
I'm going right to it. That's my next question. How did we have twins? Both extremely obese. Hubby smokes pot, and I got pregnant with pre-cum.
Yeah. The pre excretions, or what's commonly called pre-cum, from a male can contain sperm. So as long as there's sperm there and you were ovulating and you either ovulated 2 eggs or one split into 2, you could still get pregnant. Being obese, having a husband that smokes pot reduces your chances, but it doesn't eliminate them. Nobody's chance is 0. So you have to be missing your uterus or your fallopian tubes or have 0 sperm to have a chance of 0. So as long as the pieces are there, then you can still put the puzzle together. Is the chance lower? Yes. But is there still a possibility? Yes, there is still a possibility.
TikTok just blew up somehow.
Yeah.
They gotta wait. Everybody's got to turn here. I don't need to get in trouble here. I will go out of order for this one question because it's related to the bacteria soup question. It's a very simple yes, no answer. Would having a bath before an FET be considered a bacteria soup?
Well, it depends. If you're taking one of the lobster baths my wife does where she comes out beet red at the end of it because it's like scalding hot. I can't even get in them. Then yeah, that's probably not a great idea. But if you're taking like a lukewarm bath and you're not in there for that long, that's fine. But no one likes taking lukewarm baths that I know of.
No one does that?
No.
I don't even like taking a bath, to be quite honest.
Really?
If I may have a moment, I'm not a bath kind of guy.
I'm not going to say anything because it'll get me in trouble. We're going to keep this as PG as a fertility show.
Because I opened just now.
Yeah. I will tell you that my wife takes baths literally almost every single night.
I think it's very different for a man and a woman.
Yeah, I'm not a big bath guy either, but...
I'm not comfortable with the whole scene. You know? I'm not there for that. It's just...
There's a whole visual going by right now.
There's too much of me in the water. You know what I mean?
Okay, next question.
A little bit of banter.
If I could keep it together.
A little bit of banter for everybody. All right.
Carly just said something on TikTok. Oh my God.
There we go.
I love you, Carly. You're hilarious. Yeah.
Okay. Back to the questions.
Okay.
Can you do both NIPT testing
No, we asked that.
Oh, we did that? Great. Hi, Dr. VT. We did that? Okay, IVF funding. Yeah. Is IVF funding waitlist different at each clinic?
Yes. The IVF funding wait list is different at every clinic. People have different criteria. They have different durations. There's all sorts of stuff. So right now our list is not that long because we managed to get through it and we have a very efficient system. So we do have funding for people that need it within a reasonable time frame. There are clinics in Toronto that have a 3-4 year wait list. So there are differences in clinics based on the funding for sure.
Hi, Dr. V. What are your thoughts on Androgel for 3 weeks before egg retrieval?
Yeah, I love Androgel. We use it all the time, so I'm a supporter of Androgel. We use it 2 weeks before you start your stim, so it's actually 4 weeks before egg retrieval, roughly speaking. And the studies would support that you'll get more eggs and a higher fertilization rate. So I believe in it. There's even one study that suggested higher live birth rates. So I'm a believer in using the Androgel for sure. I think it works. Thumbs up. Lots of thumbs up.
Hi, Dr. V. When is no longer safe to sleep on your back in pregnancy?
It's a great question. So at 20 weeks of pregnancy, your uterus will start to come above the bifurcation of your aorta. So the main blood vessel in your body is called your aorta. That's the one that takes the blood from your heart and distributes it to your body. And as it comes down, when it reaches just kind of below your belly button, it splits in two and covers your left side and your right side. So once you get past 20 weeks, you're right at that level of your belly button. And at that point, the uterus starts coming up onto the actual aorta and inferior vena cava, which is the main vein that brings blood back to your heart. So your aorta is so strong because your heart squeezes and pushes that blood through, you're not going to squash it with your uterus. But your inferior vena cava, which is bringing the blood back, is not under pressure. And because it's not under pressure, you can't actually compress it. So what will happen is if you're asleep and you compress your inferior vena cava, you don't get enough blood going back to your heart. Your brain immediately recognizes that and tells the heart to pump all the blood to the heart and to the brain. What did you do? You just shut off the blood supply to the baby. And that's dangerous for the baby. You can't actually theoretically cause a stillbirth. And we know from cesarean section studies that when we lie patients flat to get them ready for a C-section, within 30 seconds you can compromise the blood flow to the baby, which is why we always put wedges underneath the patient's right side to tilt them a little towards their left. So it can be, a compromise for the baby. And so after 20 weeks, you don't want to be flat on your back. You have to be on your right side or your left side. Doesn't matter which, but don't be flat.
For me, I can only sleep flat.
On your back?
On my back.
Oh, I'd be snoring like a demon within seconds if I'm flat.
There's rumors that
that's happening,
but I don't believe
Yeah.
it. I don't believe it.
I'd be kicked out of bed if I was flat on my back.
It's good quality sleep, though.
I can't sleep on my back.
Really?
No, I'm a side sleeper.
Sleeper.
I'm an arm under
I
the
can also
pillow.
do a side sleep.
How many of you are arm under the pillow sleepers?
Oh, I go all the way. I need the cold on my hands.
Yeah,
I need the full reach.
I need to be underneath my pillow.
There you go.
Right arm. But you know what? It kills my shoulder. I wake up
You
sore.
wake up stiff?
Yeah.
Really?
Yeah.
I gotta switch the arm. Mid-sleep switch.
I try that. Yeah, and then I'm leaning on Wendy, and she
kicks you off
because
right?
I'm snoring.
Yeah, I know that feeling.
Yeah.
I need the full stretch. Some people could never sleep on their back or stomach. I could never sleep on my back or stomach.
Yeah, side sleeper. Yeah, and then Jess on
it.
TikTok is saying she passes out during her ultrasounds
Oh,
because
yeah?
they lie them flat. I got that complaint today, actually. Patient said they kept passing out, so now they're coming here because we let them sit up more.
Really?
Yeah.
You can actually pass out from that quick little...
Oh, yeah.
Really?
Your heart will shut off blood supply.
Oh, wow.
Yeah, you'll take it all, it's hard to get it to come back. And then you immediately pass out because you just can't provide enough. Because remember, you've got gravity going on.
Yeah.
Your uterus is sucking up a ton of the blood flow. The rest of it's sitting in your legs. It's not all coming up. Now you lie down flat.
Oh, yeah.
The little bit up here isn't getting oxygenated.
Sure. You just go to sleep.
Boom.
Unbelievable.
Yeah.
Learn
It's
something every
serious.
day.
There you go.
It's serious.
There you go.
And I thought that was going to be a silly question. See, there's no silly questions. I guess that's referring to the sleeping. People said I need to hear the answers. I've heard mixed things on this.
No. Don't sleep flat on your back after 20 weeks. Up to 20 weeks, it doesn't matter. You can't compress anything. But, with one baby. If it's two babies, that's a different story. But with one baby, up to 20 weeks, you're fine. After 20 weeks, don't sleep flat on your back. It's a risk.
Hi, Dr. V. Is there a benefit to progesterone injections before and after FET, or will suppositories do?
Oh, no, there's definitely very proven significant benefits. There are many studies showing that VAG and progesterone and oil are better than just vaginal suppositories. So PIO with VAG is better than VAG alone. I got Fred calling on TikTok now.
I see that.
Yeah.
You got to pause them or something.
I think I can probably stop.
You got a lot of viewers right now. Just throwing it out there.
Oh, look at that.
Now we know.
The reach around. Yeah.
Hi, Dr. Victory. What are the concerns about an FET with a mosaic embryo? Thanks.
Well, miscarriage would be number one, or failure would be, number 1 and 2, those two. Miscarriage and failure. There would be a very small percentage chance that you could have a baby that has a genetic problem. The studies are more and more supporting the idea that if you successfully conceive with a mosaic embryo, the likelihood is very high the baby will come out normal, but not all babies. There is a very small percentage of babies born from mosaic embryo transfers that are not genetically normal babies. You can figure that out during the pregnancy, but you need an amnio, and that has risks as well.
I'm going on 8 weeks of progesterone. I am 7 weeks pregnant now with bleeding. Is this normal? Also to note, I am on 2 mLs of progesterone.
No bleeding in pregnancy is normal, so you should always be checked out. Easy.
Is it typical that FET babies are born larger than average? If so, why?
There is evidence supporting the idea that frozen embryo transfer babies are LGA, larger for gestational age. I can't say that I see it because we do almost exclusively frozen embryo transfers, and I can't say that all my IVF babies are LGA, but the studies support that there is a tendency towards more LGA with frozen than there is with fresh. On the flip side, there's a much higher incidence of growth restricted babies with fresh than frozen. And if I had to choose between a big baby and a small baby, I would pick a big baby every time. So the small babies have much higher lifetime risks of diabetes, high blood pressure, all sorts of metabolic disorders, heart attack, stroke, that kind of thing.
A lot of REs don't believe in using DHEA, and some say should be monitored very closely. What are your thoughts, Dr. Victory?
My thoughts are that they don't read the studies. The studies show, and there's meta-analyses and systematic reviews, that it is beneficial, and no one's monitoring. So I don't think you need to monitor, and the studies support the fact that it's safe and effective.
How about this comment?
Oh God, is it an era comment?
You are the best.
Oh, that's very nice. They were probably talking to you.
No Tarek mentioned, so I think it's you. Can you try to get pregnant with an intrauterine fibroid?
Well, can you try? Yes. Will you be successful? It's a 50% reduction in success. Are there risks? It's a 100% increase in miscarriage risk. So would I recommend it? Never. But can you, should you, would you, whatever, those are all decisions you have to make for yourself. But it's a 50% increase in miscarriage, a 50% decrease in success and a 100% increase in miscarriage risk. So an intrauterine fibroid, meaning it's in the cavity at type 0 or a type 1, you should not be trying to get pregnant. Those should be removed first, in my opinion.
Hello. What are the chances of Clomid being successful for unexplained fertility and not diagnosed with PCOS? Thanks for sharing.
3.1 to 4.3% is proven to be useless. Don't do it. It's a waste of time, it's a waste of money, and it will not help you. It's probably one of my biggest frustrations is getting patients that have come to us having done fertility treatment either through a gynecologist or a family physician where they were given Clomid or letrozole for unexplained infertility. It's a complete waste of time. It's been proven to be useless. We have a great video on YouTube on unexplained infertility, very scientific. It was for a talk I gave at a conference before. I literally went through every single step of every approach and put all the guidelines together, American, Canadian, European. It's all right there for you. So it tells you what works, what doesn't.
36 years old.
Okay.
5 miscarriages.
Oh, I'm so sorry. That's terrible.
All tests come back normal.
Depends on what they consider all tests.
Should I keep trying or consider surrogacy?
You need a consult with either myself or someone that is a good reproductive endocrinologist or reproductive immunologist to figure out why you're having recurrent pregnancy loss. I can't tell you if you should try with a surrogate until I know what's wrong. Sometimes yes, sometimes no. It's quite easy to fix. So I need to know what's wrong first. We have loads of patients. I have a patient in South Africa, literally in South Africa. They contacted me. We went through things. I told them what to do. She changed some stuff up. Now she's successfully pregnant. Horrible endo, lots of problems. She ended up doing fine. So it all depends on what's wrong and what they've done. I get people all the time that say that they've done all the tests, but all the tests could mean different things to different specialists, right? So it depends on what they've done for you and what they did about what they found.
Is the management of pregnant patients without thyroid any different?
Is the management of pregnant patients without a thyroid? Yeah, you just need your thyroid levels monitored constantly, but that's not a big deal. That's easy to do.
You can handle that. We
can definitely handle that.
I don't know much about thyroids, so challenge for me to be honest.
Do you need prednisone before FET? We use it. Richard Scott told me that when he was very young and just starting out, they did a study in-house which demonstrated that it was beneficial, and he never went back to restudy it. So he uses it, and I trust him quite a bit. We use it as well. To me, it makes sense. And if you look at the overall steroid literature, it does kind of favor a trend towards improving things. So I do use it.
Wrapping up here,
Okay.
902. What are the changes? Hold on. What are the chances to get pregnant with IVF treatment at 40 years old? What is the percentage from 0% to 100%?
That's an impossible question to answer because I need to know everything about you. Your height, your weight, your partner's sperm quality, your personal habits, smoking, drinking, drug use, his habits, DNA fragmentation from the sperm. I need to know, what you've done before. I need to know your AMH levels. What's your vitamin D level? There's a lot that goes into it. What's your thyroid like? There are many things that go into this. So I can't tell you what your IVF success is going to be like. I can tell you that if you look at national averages, you'll find 8%, 11%, 15%, things like that, depending on which country you're looking at. I can tell you our success rate's much higher than that, but it depends on who we're talking about, right? So I would never just blanket say your success rate is going to be this because I don't know anything about you yet. I need to know your details.
You're so funny when you're exhausted. It's a comment.
I am exhausted. That's true.
All right, last one.
Okay.
And it may not be the last one, unfortunately, but it's... you know what? As of this second in time, it's actually the last one.
We're doing okay.
Yeah,
all right.
we're doing okay.
Yeah.
Okay. Oh, not the last one anymore. Just changed. But it's a measurement in time.
Okay. I love your pauses.
Because
They're they're so appropriate because I can call them a pregnant pause, which is perfect for a fertility show.
That's good. It's the pregnant pause. Absolutely.
Yeah, you get us all wound up and then you just leave me hanging.
Here we go.
Yeah.
Here we go. Because there was people started answering the question, so I'm trying to figure out where the question go.
Okay.
Supplement dosage.
You guys can't see this, but in the meantime,
there's a lot of that going on.
He's doing this. Yeah, go ahead.
Hand talker.
Supplement dosage.
For turmeric and NAC before an FET.
NAC anywhere from 1,000 to 1,500. Turmeric depends on the formulation. We use 60 milligrams. That was too easy.
Well, they have follow-up. Would you like to hear the follow-up to that?
Sure.
So the viewers decided that perfect for day 6, if that's in the Canadian lab units, 3,000 and 6,000 is ideal for day 6 or day 7. But let the expert confirm.
Of what?
I just read. I don't,
3,000 or 6,000 of what?
NAC?
3,000 units? Oh, God, no, that's way too much.
There we go.
Yeah, I wouldn't be using that much. That's a huge amount.
Let the expert confirm.
Yeah, that's way too much. Yeah, I don't recommend that. I don't think any of the supplement manufacturers recommend that. Okay, folks.
We have one more if you'd like to just...
One more quickie.
It's the last
I got
one.
a whole bunch of people I got to call because they called
I
in
saw
the
that.
middle
I
of
saw
the
that.
show.
Completely ignored them.
Yeah.
What blood tests
Yeah.
do you run before starting fertility treatments?
Oh, AMH, vitamin D, TSH, prolactin, FSH, LH, DHEA, testosterone. This is in women. A follow-up prolactin if the first one's high. We do serial monitoring. We check at day 23 progesterone, estrogen. I think that's all our blood tests. Oh, infectious disease screen, of course. We check everybody for that. I think those are the major ones we're doing. Yep. Done. For the guys, similar. Not all the same stuff. We don't do AMH for guys. Or vitamin D for that matter. Okay, well, I'm not totally exhausted, but I am tired. I had a late drive back from my cottage last night. Huge shout out again to all of our wonderful fans. Thank you for watching. Thank you to our crazy folks on TikTok who livened up this evening's festivities. And we will definitely join you again. Do I do virtual consults? Last one on TikTok. Yes, we do. We do virtual consults every day. Living in Toronto is not a problem. A lot lot of our patients are from Toronto. As I mentioned earlier in the show, we have people coming from South Africa, so Toronto is really not much of a stretch. Would be happy to help you out. So reach out. All you got to do is email info@drvictory.com, info@drvictory.com. You can access it through our website as well, which is also drvictory.com, and we will be happy to help you out. And hey from Niagara Falls. Hello.
Hey.
I was just in Niagara Falls. I did the Maid of the Mist thing. I don't understand how water goes up the poncho, but it did. You guys have a wonderful evening. We will see you next week on Fertility Fact or Fiction. Take care, guys. Bye now.